Hey guys, welcome to the lesson on cardiovascular angiography. So during the cardiovascular angiography, the doctor inserts a catheter into the artery in the inner upper leg near the groin area, and they thread that to the vessel supplying the heart. Contrast dye is injected into the catheter, and an X-ray is used to view the vessels. Intervention is provided by the doctor as needed, like stent placement to open the arteries, for example. Let's discuss the purpose of this test. So the procedure helps to view the blood vessels supplying the heart, to diagnose disease in the coronary arteries or the valves. So the doctor is going to be able to see any obstructions or blockages to blood flow that may cause a myocardial infarction, like in these pictures here. Let's discuss why this test is done. So the doctor might choose to order this test if the patient's having chest pain, if they have really bad heart disease or valve issues or any heart defects. So let's talk about what to do before the procedure. Before the procedure, the patient's going to be kept NPO for 6 to 8 hours, usually the day of. That means no food or drink. Ask the patient if they have any allergies to contrast, because if they do, they might not be able to have the test done. If the patient's on anticoagulants, ask the doctor if they want to hold them and for how long. Explain the procedure and have that consent signed by the patient. The consent might be done right before the procedure so the doctor can explain the risks. So during the procedure, you're going to clean and shave the site on that upper inner leg and the groin area. You're going to provide IV sedation to help the patient relax before the doctor places and threads that catheter. You're going to monitor the vital signs during for any deviations from normal while the catheter's in the main arteries. Here's a picture showing that catheter going up and all the way up into these vessels supplying the heart. After the procedure, the doctor is going to remove that catheter, and you're going to need to hold pressure for about 10 to 15 minutes after. A closing device might be used. Keep the patient flat for 2 hours after to prevent bleeding, and keep that leg straight for at least 6 hours. Assess for bleeding on that site. Hold pressure if it does start to bleed. Next, let's talk about patient education. So let the patient know when they can restart those anticoagulants if they are on them. They might resume their normal activities the next day as long as everything's going well, and tell them to let you know if they notice any redness or pain on that injection site. So the priority nursing concepts for the patient with a cardiovascular angiography are safety, perfusion, and patient education. All right, guys, let's review the key points. So the cardiovascular angiography is done to view the heart vessels using contrast and an X-ray to diagnose any defects or blockages. Before the procedure, keep the patient NPO, get a consent signed, and hold anticoagulants according to the doctor's orders. During the procedure, clean and shave that site on the upper inner thigh groin area and provide the IV sedative per doctor order. Check their vital signs during the procedure for any deviations because you're in that main artery. After the procedure, hold pressure for about 10 minutes and keep them flat for 2 hours, and keep the legs straight for 6 hours after to prevent any bleeding. Let the patient know when they are able to restart those anticoagulants and assess the injection site for any bleeding. All right, guys, that's it on cardiovascular angiography. Now go out and be your best self today, and as always, happy nursing.